I keep seeing the same uncomfortable question pop up. If a doctor uses AI and the AI gets it wrong, who should actually pay the price? I came across a recent story that made me pause and think. On one hand, I can see why people are raising the question of AI developers' responsibility, but on the other hand, I still lean toward a simple principle. A doctor should always think independently. That is what separates clinical judgment from a patient simply searching online, or, today, asking an AI chatbot. In the UK, doctors are starting to push for a big change in how responsibility for AI mistakes is shared. Right now, when a doctor checks an AI tool, sends its conclusion to a patient, and the AI turns out to be wrong, the doctor is usually the one held legally responsible. This happens even if the doctor disagreed with the AI and still ended up making the wrong decision. But now, British doctors want to shift part of that responsibility onto the companies that develop these AI systems. The Medical Protection Society, one of the largest UK organizations that defends doctors in professional liability cases, released a report arguing that if an AI recommendation comes from an algorithm officially registered as a medical device, then the responsibility should fall on the developers, not just the clinician. They based this idea on the new European Union Product Liability Directive from 2024, which will come into force at the end of this year. The UK Department of Health and Social Care has said it will look into these recommendations and provide an official response. Today, AI-based tools are already being registered as medical devices in many major jurisdictions. In the European Union, AI software intended for medical purposes is classified as a high-risk AI system and must comply with the medical device regulation. In the United States, the FDA treats many AI and machine learning tools as software as a medical device when they support diagnosis, treatment, or clinical decisions. Canada, Japan, China, Australia, and Singapore are also building risk-based frameworks for AI in medicine, often following international standards. In many of these countries, the regulatory system for AI medical devices is already in place, but the rules about who is legally responsible when AI causes harm are still being shaped. The UK conversation is part of a larger global trend where the question of liability is slowly moving from only the doctor is responsible to a more shared model between the clinician, the healthcare organization, and the AI developer. So far, the final verdict in most places still rests with the doctor. AI is not replacing doctors, but the legal system is beginning to ask whether doctors should be the only ones absorbing the risk when an AI tool fails. The UK decision in the coming months could become a turning point for how many countries handle accountability for medical AI. In practical terms, this change would matter most in areas where AI is already heavily used, such as radiology, triage tools, clinical decision support systems, and AI scribes that help doctors write notes and summaries. If an AI system gives a wrong diagnosis or recommendation, and the harm follows, patients could find it easier to claim compensation from the developer under product liability rules, while doctors would no longer be the only target of legal action. For doctors, this could reduce the pressure of being the sole insurance bag for system failures. For developers, it would mean stronger incentives to build safer, more transparent AI because they could face more direct legal consequences. For patients, it might improve trust in AI-assisted care, since the system would have clearer accountability. But it also raises new questions about how to prove that an AI was defective, how to handle cases where the doctor misused the tool, and how to coordinate insurance between clinicians and companies. Right now, the UK is still studying the proposal, and no final law has been passed. The outcome will show whether Britain moves closer to the European model, where software and AI are more explicitly tied to product liability, or whether it keeps a more fragmented approach. Whatever happens, this debate is likely to spread to other countries because the core problem is global. AI is already part of medical care, but the legal framework for responsibility is still catching up.